Hello friends, good morning all. I am Dr. Kolas, veterinary surgeon working under State Government of Odisha. Today I am going to deliver a lecture on black butter, which is very much important in field conditions and very much important for academicians, field functionaries as well as the grassroots level workers. So let's discuss about the disease black butter. So black butter is a disease, mainly a disease of cattle and the even footed animals. So generally, so the synonym is black leg and it is caused by a gram positive bacteria known as Clostridium chovi. So as long as this is a very acute infectious diseases means the onset of the disease is very short and the clinical manifestation of the disease also the duration is also very short, and this disease is characterized by inflammation of skeletal, cardiac muscles. Very much important. You find the symptoms on skeletal muscles, that is mainly on thigh muscles, and the cardiac muscle on PM findings, and this is exaggerated by a severe toxemic conditions, and this leads to the high mortality rate, means there is a heavy mortality of the cattle, means heavy numbers of death encountered in the cattle. So coming to the causes, that is etiology. So the true black leg, or that is the black butter, is characterized by the clostridial myositis of the skeletal muscles, and that is mainly caused by the organism Clostridium chovi. As the clostridial organisms are these are mainly the rod shaped organisms, as well as they have a nature of spore formation. So the organism, the spores remain in the soil for years to very long period of time, if the soils or the utensils, the fomites are not disinfected properly. So I have already told you the gram positive spore forming a rod shaped bacterium. Okay, the spore of this organism is very much resistant to the adverse natural conditions or environmental conditions, and it remains in soil for many years. Okay, so another types of false black leg is also there. It is called like Clostridium septica and Clostridium novi. But after clinical examinations or after the your lab detection, you can detect between the Clostridium septicum, Clostridium novi, and between Clostridium chovi. Coming to the epidemiology, the number of the animals affected within in a space of few days, as I have told, it is not for acute, but it is acute disease. So the space of time is very less. So it is angiotic in a particular area, means it is confined to a particular area. Okay. I have seen in practical cases when I am going for vaccination for BQ in a particular in a outbreak villages. I have inquired, the disease has been persisting there for years. The main source of infection is soil. If the soil is not properly disinfected, or the fomites, the inanimate objects are not properly disinfected, the spores will remain for long years. And another portal of infection through elementary mucosa and the ingestion of the contaminated feed. So if there is abrasion, there is any broken mucosa in your mouth, then the organisms invade very rapidly to the body system, and the contamination of the soil and pastures occur from the infected feces and the decomposition of the infected carcass. So throwing of the infected carcass to here and there, as well as the not not disinfecting the soils. So, and both these conditions predisposes, or the both the condition causes vulnerable for another animals to get infected. So spores proliferated by the trauma and anoxia. So transmission from, I have told already, for direct to direct contact for it, or from soil to animal, or through contaminated fishes or the contaminated carcass. Environmental, as I have already in a disease triad, the it is environment, it is agent, okay, and it is the your host. So any in this triangle, any factor deviates from this normal leads to disease in other two factors. So environment factor also a very important factor. Then animal risk factor, the host factor, also a very important factor. So you must remember this pig, the pig in pig this is carried by gas gangrene caused by the Clostridium or Clostridium septicum infections. It is very important. It is not a black plague. It is a gas gangrene. It is frequently asked in GRF examinations. Generally, this disease is confined to 6 to 2 years of animals. Because why I don't know, because the growing stocks are morely harboring this infectious agent. uh, maybe these animals are uh, placed under high plane of nutrition. That's why the organisms may have a chance to get proliferate very rapidly. And as it is a very acute disease, it causes a very economic threat, a huge economic threat to the uh, farmer. So coming to the pathogenesis, the growth of the latent spore. So the as the method or the mode of transmission is by spore through either ingestion or through any contaminations. So the bacterial spores are the main predisposing factor for disease outbreak. So toxins produces necrotizing myositis in caloric muscle system toxemia. So the spores or the organisms, they produce a toxin and that causes a toxemia means there is a high rise of toxin level in the blood, and that toxin is generally confined to the skeletal muscles and causes systemic toxemia. So this leads to the outbreak and sudden death due to clostridial, and the disease is and the death is due to the cardiac myocytosis, means the heart muscle is generally affected very. So in clinical findings we will get the disease is, as it is a very acute disease, it is 4 to 5 days. So animal will not will show signs symptoms like very depression, have complete anorexia, and the ruminal status means there is no ruminations. Temperature of the body goes up to 106 degree Fahrenheit and pulses up to 100 to 120 per minute. Severe lameness, because it is a disease of skeletal muscle, so we will find symptoms like swelling or the edematous swelling of your thigh muscles, your leg muscles, and the animals will show reluctance to move. And in early stages swelling is not hurt, but in when we encounter a case of BQ, we'll find in initial stages the swelling is very hot and painful. If we touch that affected part, that animal will not show its leg or show its part. Then the after the completion of your incubation period, then that part becomes very cold and painless. It's a very important features. Then coming to the edema and emphysema of affected muscles, skin is discolored because there is high production of H2S gases, and that causes the muscles very dark. Okay, so occasional lesion found in the base of tongue, heart muscles, and psoas muscles, the brisket order. When toxemia develops very rapidly, animal dies within 30 to 60, 30, 12 to 36 hours. So this is a case of BQ in bull. So we generally find these cases here. There is a necrotizing of the skeletal muscles. In some cases also here. You just mark these parts. This is a beef cattle. Between order will show also it is a smooth muscle. So then it is not found in a smooth muscle, it is more in cardiac muscle. So find this area, it is very dark in color. In case of sheep, this is characterized by high fever, anorexia, depression, and death. Stiff gait and sheep decline to move due to severe lameness. So lameness is a very important feature in this disease. So we have to very careful uh, to get a conclusion whether it is a BQ or it is any or lameness due to any other diseases. So we have to go the vaccination status report, the all this the previous feeding report. So here skin necrosis and gangrene is not a feature. In cases also all horses, there is also findings of the BQ in horses. You just see. This is symptom of lameness. So in clinical pathology, in acute cases, necropsy material, so we have to collect the samples, the blood serums, the muscle samples from your both skeletal muscle as well cardiac muscle is very important. So as it is a disease of muscles, so generally serum SGOT level get very level get enhanced or get increased to a very larger height. So SGPT and SCOT, the enzyme level get the level get increased. So necropsy findings, blood and putrefaction of the carcass, blood stained with froth exudates from the nostril and anus. Affected muscles become dark, discolored, and swollen, and in some cases it is rancid or of a metallic sin, and then there is signing of your muscles. In cardiac myocytosis, cardiac muscles and diaphragm are abnormal with massive accumulation of blood stained fluid with acid deposition of the fibrin. You will find the total charred color muscles. You find myocytosis. Skeletal muscle, you just see. This is total discoloration. This is discoloration. This is the normal. This is the BQ affected cases. Okay, now coming to diagnosis. In case of outbreaks, very few epidemiological analysis may be done. We have to take the history of the incidence of the disease. And we have to see the pattern of the disease and ensure in which season it is more prevalently occurring. Age of the group of the affected animals, pasture, soil, vaccination status, and we have to go all these things and collect all the data and clinical science and necropsy findings, isolations, bacteriological examination, and culture of the organism is of paramount importance. So we have to, and then very simple test. We have to go for the gram staining process. The whole process, all my vet professionals might have known. It is a fixation, crystal violet, iodine treatment, then decolorization, then counter stain. So through all this process, we have to go for the your gram positive and gram negative staining or gram staining. Okay, you just see this is the very rod shaped organism. Bacteria bacilli. This is blue color. Clostridium chobi organism. Rod shaped, very important. So we have to very cautious in differentiating between lightning strokes, anthrax, unclotted blood and septum slanning, bacillary hemoglobinuria, lactation tetany, acute tuberculosis. So we have to take the history of the animal, the surroundings, the vaccination status, the symptoms, clinical symptoms. So in all the cases, and we have to ascertain it is and after doing the laboratory examination, we have to conclude that it is a case of black water. So treatment, the penicillin group of drug is very much importance and show a very good results in curing this disease. So penicillin dose 10,000 international unit per kg body weight is very much important in treating this disease. And oxytetracycline at the rate of 20 to 20 mg per kg body weight also very much important. So BQ serum holds also very important, but it is in practical condition we generally don't have this. Another in practical clinical condition we are going for also some ceftriaxone group of drug. Ceftriaxone plus tazobactam, ulcerabactam we are giving. It is 8 to 10 mg per kg body weight, and we are giving up to 4.5 gram per animal. But it is a costly drug. So the procaine penicillin is the fortified penicillin is the drug of choice for this disease. So how to control this disease? This is of importance. So go for vaccination between 6 to 12 years to 2 years of animals, and after giving, suppose you have given on 0 day the first dose. Yeah, you have given 0, then after 14 days you have to give the booster. Then after this again after 6 months you go for the next vaccination. So this is the criteria followed in the field conditions. Thank you.